What is your job title?
So I'm a physician, I'm a gastroenterologist. So I study diseases of the stomach and the colon throughout the GI tract.
How long have you had this job title?
So I've had this title as a doctor since 2002, but gastroenterologist since about 2010.
What is one interesting thing about this job?
One interesting thing about my job is that I'm able to listen to people when they're having problems and help them figure out what's going on in their body. And a lot of times we're able to make people feel better if they were having problems before.
What is one of the hardest things that you've done in this job?
I would say the hardest thing that I do in this job is having to tell people that we can't help them. Sometimes people have a very bad diagnosis. People can get cancer, and sometimes we can't treat the cancer. So having to tell people or give people bad news is the hardest part of my job.
How much education do you need to have this job?
So you will be in school for a long time to be a physician. So you have to finish high school, and then you go to college, which could be 4, 5, 6 years. You can go to medical school after that, which can be 4, 5, 6 years. And then after medical school, you're called a doctor, but you're not really specialized in anything. So in my case, I did internal medicine, which you would expect maybe a typical family doctor would do, and that's about 3 years. And then I did an extra year to be chief resident to help run the training program at my hospital. And then I did 3 years of gastroenterology to learn how to do procedures to look inside the stomach and the colon. And I did 1 extra year after that, so it adds up.
What does an average day look like at your job?
So an average day for a gastroenterologist could be in the clinic seeing patients if they're coming into the office, or you could be doing procedures. So half the time we're in the office seeing patients. So if your older brother or your mother or father had stomach pain, they might come and see me in the office. But then the very next day I might be doing procedures. So if somebody's worried about having colon cancer or if they have severe heartburn, then I take something called a scope, which is a camera attached to a long tube. I can go down the throat, or I can go up the other end, and I can actually look around and see what's going on inside.
Thanks for spending some time with me today.
You are more than welcome.